So, good morning, good afternoon, or good evening, everyone, wherever you are. And we're here today with our guest. He's a very interesting person. And yes, he's a man because, we also take into account men. His name is Greg Conlan. Hi, Greg.
Hello, Monk. How you doing?
I'm good. I was thinking, Greg, so this morning you got up or you came back from work and you took your simple steps to being healthy. So, what is it you did yesterday? Would you care sharing?
It's just that's fine. I'm happy to share. So every day is the same. I get up at 5:30 and I walk 45 meters this way. I beat my card and I go to my gym. That's what happens every morning. It's the same every day. So I'm a creature of habit. I'm
Okay.
known for being very simple, very consistent, and not too hard. That's my style.
And what happens at the gym?
Depends on what day of the week it is. So every day is a little different. At my age, it's you got to be mindful of recovery. You got to be mindful of what your goals are, and the key is to be there tomorrow. So I always make sure that I leave a little bit behind, and I turn up tomorrow so that I can turn up and turn up and turn up and turn up, and that's where the bricks of the wall of being well are built. So I'm constantly reminded of the tortoise and the hare. That story is 2000 or more years old, and it holds true today. It's We don't want to be running too fast, having breaks. Our body responds. It doesn't know what day of the week it is. It doesn't know if it's Monday or Christmas Day or your birthday. It just woke up today. It doesn't care. And so it just needs a little bit of love every day. And that's where the secret is. So that's how I start my day every
And you
day.
call that simple
Simple
step,
daily.
simple daily. Okay. So,
Simple daily. It's sitting here like on my desk right here. It's just sitting there right in front of me. I don't know if you can see that.
it's blurry. It's blurry.
It's
I'm,
blurry. It says simple daily. It sits right there beside my screen.
I'm gonna just do that here as well.
Yeah.
So, Greg is a chiropractor with more than 35 years of experience. He's based in Melbourne, Australia, not Melbourne, Florida. But you could tell by his accent, I guess, just even
Yeah,
before
it gives
he said.
away, doesn't
Yeah.
it?
And he's spent all his professional career taking care of musculoskeletal health of people in general, but he's very determined to help women throughout all the different phases in her life to find well-being and to just feel better and to have a body that supports any activities that they want to do. So he's got this simple daily, how do you call it, like a logo or motto,
That's
which,
just a motto. Yeah,
yeah, it's
simple
like a
daily.
motto,
Yeah.
which
I,
you,
I'm a I'm a man, Mon. I hate complexity. I'm not good at complexity. Complexity gives me a headache. I love simple, repeatable, daily. It might sound boring to some people. It sounds wonderful to me because I
oh,
know it's very, very
I think
successful.
a lot of us women could just take some advice on that because sometimes we obsess too much about, things having to be perfect or to have to be one way or to
Hmm.
have to complete. So yeah, simple daily. Let's talk about that.
Simple.
Yeah. So obviously we're here because our page, our project, Grace of No Age, caters for women going through menopause at the beginning or before, during, and after. And our musculoskeletal health is something that can be affected due to the hormonal changes. So you might hear in your practice, Greg, women complaining about feeling stiffer as they get older or when they're going through menopause, and that
Hmm.
feeling that this stiffness is something that they didn't have before. Yeah. So, what is it that happens to our joints and muscles during menopause?
Well, many, many things, unfortunately. So, what's probably not aware to a lot of people is that many, many cell types in your body have a sensitivity to estrogen and respond to estrogen. and they've had 35, maybe 40 years of being exposed to a particular level of estrogen. And so that cell does its thing based upon that product stimulating it. The product, estrogen, is no longer there in those kind of amounts. And so whatever that cell does is reduced. And so a number of things are occurring in the joint where the joint is encapsulated by this thing called a synovial membrane, and it's very estrogen sensitive.
Mhm.
That synovial membrane applies some fluids into the joints that grease those articular joints. And so, in the absence of a high estrogen load, the joint grease, if you will, is suddenly reduced. It's not gone, but it's reduced. Consequently, that joint is not going to be as greased and supple, and those nice articular surfaces aren't going to glide over each other just as well. And similarly, the ligaments that sit around the joint, the tendons that go over the joint, all those tissues are estrogen sensitive. So none of them are going to be as supple as they were, as elastic as they were. They're going to be a bit tougher, grindy. They're just not going to operate as well. So it's no surprise that there's stiffness and aches for a person who's a little pre and certainly during menopause. And in fact, that problem is called arthralgia.
Okay.
Arthro meaning joint, algia to mean pain. So just pain in the joint. And it's believed that more than 50% of women will suffer from this arthralgia. And even then, worse is that estrogen is known to be a suppressive of the mediators of inflammation. So suddenly, now even your inflammation mediators start to rise up a little bit. So not only does your joint feel a bit worse, but the inflammation's a bit higher, and the estrogen's not there to suppress that. So
Yep.
and we could go on and on and on about the physiology of that. It's a very rich field, but you just need to know that estrogen is crucial for maintenance of joints in men and women. We have it too.
Yeah.
It's just that we don't tend to have these fluctuations in our levels at the level that a woman is exposed to. So
Mm. So
that's the reason
do
why.
you know if or do have you had experience with women having uh, a hormone replacement therapy? Would that make a difference in the joints and the muscles? Like, because then their estrogen levels,
Sure.
obviously, they are kept higher. Yeah.
Look, so I'm not a medical doctor and I don't prescribe HRT. So I will stay in my lane about conversations around hormone replacement therapy. However, anecdotally, plenty of women are telling me that they feel better at a multitude of levels
Okay.
with some HRT. So, if someone said to me, do you think I should take it? I'd need reasons to work out why you wouldn't take it. I mean, would be my take on that. So it's a chemical you've had in your body for a long, long time. Why is it going to be an issue now? Would be my thinking.
Uh-huh. Fair point. Yeah. So talking about inflammation, which obviously I can relate to because suddenly, your belly it's inflamed and not only gets inflamed, but you start accumulating body fat on your belly, which is super difficult to get rid of, no matter what you do, it's kind of
Yeah.
mission impossible. And you have a little bit of extra weight there. So what's the effect of that belly fat on the
Yeah.
function of the spine, on just the mobility of women?
Well, you're changing your shape, aren't you? And it's not the woman's fault, as the estrogen goes down, your fat distribution is going to go more in a male-like manner, which, as we all know, men, as the older we get, we lose our backsides and we start to get a bit of a belly. And with women, that's exactly what happens too. So you start getting that distribution of weight at the front. around the belly, less weight on the backside, less weight on the thighs, and just sort of goes in that sort of middle section because estrogen is a very important modulator of our metabolic system. So your insulin sensitivity, blah, blah, blah. It goes on and on and on about how estrogen, the lack of it starts to mess with your metabolic processes. So then you get this weight. Now, if you get weight more to the front, your center of gravity has shifted to the front.
Yeah.
So that now means that you've got two options in life. You either fall flat upon your face or you lean backwards a little bit on your back. And so what most people do, they put weight on their front, they start to lean backwards just a little bit. It's small, but it's significant. And then the weight on your spine goes from off the heavy part of your vertebrae
Yeah.
onto the little guides at the back. And then people start getting this weight distribution, which starts to affect their low back in particular. But that's not the end of it, because you've got a little bit more curve in your low back. There's some compensatory changes up the top as well. So that there's a knock-on effect right through your spine.
So
So
how
yeah, the weight distribution is a big issue.
so how do how can we compensate for that? I mean, if of course we can work and do our best to lose the belly fat, but we all
You'll never lose the belly fat, right? There'll be a couple of outliers who do, but most people need to be reconciled that there's going to be a little bit of weight there. Yeah. The the only issue around that is just like learning more and more about your postural well-being. And not many people know much about that. So this is where someone like your physio, your osteo, your chiropractor comes into play, where you start having to learn how to redistribute that load through your body. Lots of people can help you with that. Exercise physiologists can help. I'm agnostic as to who helps you. It just needs to be somebody who you trust. And you start to work on your postural strength. And postural strength is not just about what you can lift. It's about your awareness in your brain. It's about knowing what good posture is and being able to sense it through your proprioceptive inputs. And what proprioceptive inputs means is, how do you know where your body is in a position in space when
Mhm.
you remove vision? So that's what proprioception is all about. So we need to learn some new skills so that we rebuild our body, because our body has changed. So there's no question that it's changed. It's changed quite a lot. And you need to respond to that. So doing the sorts of things you did when you were 25 are no longer of any value. That's then, that's finished. It's all over. It's a whole new ball game when you get to this sort of period of life.
So we have to start finding new strategies to relate to our body,
Absolutely.
to the changing
Absolutely.
shapes, and obviously to do our best to kind of stay in shape, like you said, taking it
Yep.
easy without, thinking that we should do what we
Yep.
did 20 years ago.
Yep. You've
So,
you've changed. You've changed. You've changed. So doing the same things in that in that changed environment doesn't make any sense to me.
exactly. Yeah.
Yeah.
So, well, we gain some belly fat, and at the same time, we lose bone density. Yeah.
Yeah.
So, from a chiropractor perspective, so how do you help women maybe protect their bones against these laws? What do you recommend them to do? How can you work with them, or what can they do to prevent these bone loss and to make the bone stronger, even if it's not like it was before, but to do our best during this period?
So I suppose now we'll get back to my simple daily thinking.
Hmm.
This should have been happening since you were 25 years of age. This notion of building and doing activities towards maintaining or building, maintaining and keeping bone density. It doesn't mean it's too late at any stage. And there's plenty of good information these days coming from out of Griffith University, the Liftmore studies, about how women can increase bone density at any stage of life. But doing it by a walk around the block, you're kidding yourself. It is not the stimulus that's required to develop bone density. To alter a bone, you need to have a number of things in place. You need enough calcium, you need vitamin D, or this won't happen. But you also need the stress loading that's going to build that bone. So bones, while they might look like they're just solid, they actually do bend, they expand, and they compress, and they twist. And each one of those stimuli actually running through the length of that bone will create this current, which helps the calcium to lay down along that line. And so you have to be putting your body into different angles, shapes, and loads to try and stimulate that. You can't do it by taking a walk. It is too metronomic. It is not enough vertical load. It is better than nothing, but it is simply not sufficient to create bone change. And that's the big one that needs to come through. So we need women in a safe environment, lifting a little bit of heavy weight, and additionally, even doing things like some jumping, so some rope skipping, stand on a box, jump down onto the ground. Now, this is all very age appropriate, and this needs to be helped. You need to do this with somebody who can help you.
Uh-huh. So
For
basically,
some
it's
people,
lifting weight, so you kind of stress a little bit the
it's
bone.
totally about the stress. Yeah,
Yeah.
you need to stress those bony structures. That bone needs to bend a little, or compress a little, or expand a little, or twist a little. That's what that bone needs to do. And then in the presence of adequate calcium and an adequate vitamin D load, the body will simply lay down new bone. Now, it won't lay it down like it laid it down when you were 15 years of age, because bone also is estrogen sensitive. Estrogen is crucial in the laying down of bone, because bone tissue is also estrogen sensitive. But it's not no change. It's just you've got to work longer and maintain those efforts, which is back to simple daily again. You do that regularly and often enough, and you will get the change at any age. That's been now proven, clearly proven. So,
That would be kind of going to the gym, finding a professional, or to
yeah, build
physiotherapy.
your team, Mon. Build your team. Build the people around you who you trust. So I don't mind. Once again, I'm agnostic about who your team is,
Mhm.
but you need to have someone you can trust, who's going to give you some exercise advice, some nutritional advice, so, sleep. We could go on and on and on, but you need to build your team around that, and then set the plan, a very simple plan. You don't need to lift heavy weight every day, but twice a week, lifting some heavy weight as a small part of your routine is crucial for the development and maintenance of bone density. You're not going to get it by walking around the block. That's just, if there was the one thing that I could get out of people today, get them to understand, it's nice to exercise, but it's exercise specific. The exercise around the block is walk around the block is great for your mental health. It's nice to see the trees and the birds and whatever. And it's probably a little bit good for your cardiovascular system. And it's probably okay for, burning a few calories. But if the question is bone density, it is not the answer.
And
Well,
actually, just I try to hit the gym twice a week, and not only helps the bone density, but I think the fact that you are just pushing, and I love doing legs, for instance,
yeah.
it really gets your heart rate up a little bit. And
Mm,
if I'm not mistaken, that raises your metabolism, which means you start burning fat. So that's
sure.
also good for our previous point, which is the
Yeah.
losing a little bit of your belly fat. Yeah. So
Yeah.
because you keep
That's
on
right.
burning even after you've left the gym. It's
That's right. Yeah.
so
But as far as the bone density goes,
legs
it'd be
feel
nice not just to lift weight, but you also need to sort of do some jumping, sort of that. Now, I'm not talking about jumping off something high. I'm talking about jumping off, say, a step onto the ground. that sort of vertical loading is very, very good for bones. Obviously, if you're osteoporotic, take the advice of some people around you. But for the average menopausal woman, jumping off a step is just fine. Trouble is, you haven't done it since you were a teenage girl.
Yeah. So
You
what
just
about
haven't had that play.
that brings me to the next point, as we get 50, 60, we feel weaker and we feel like we just don't have the energy because we just lost some muscle and we talk about aches and pains before. So what about this jumping that you say is so crucial for women that maybe have weakness? How could they just do this jumping without injuring themselves?
Sure, sure. That's why I say build your team. You need to get some people around you. It doesn't have to be someone necessarily highly specialized, but just find some people who can help you through this because you only need to be shown a couple of times. This is not someone you don't need to be with this person 3 times a week for the rest of your life.
Yeah.
Just need to say to someone, hey, if I haven't done this sort of stuff before, just want you to guide me through this process, or even pick up a skipping rope. No
Yeah.
one's going to hurt themselves with a skipping rope. And it's good for your brain, it's good for your coordination, it's good for your heart, lungs. Skipping is a wonderful exercise.
I
Once
try.
again, you
I
probably
try
haven't done
to
it
do
since
that.
you were
So
14.
I think I'm pretty balanced and in general terms fit. Incapable of skipping the rope. It's like I get some clumsy. Yeah, it's just like
Really?
that the thing that the boxers do or you see at the
Yeah,
gym.
yeah,
I
yeah.
just can't do that. I just jump like a little kid. It's like ridiculous. So maybe I need more
I,
training.
I suppose it's not a competition though, right?
Yeah.
Just all you're looking for is the outcome of the jump.
Yeah.
And I think you'd actually have a laugh and a little bit of fun. And as far as your bones go, it's good for your balance. And as I talked in my clinic every day, it'd be 3 times a week. I have a woman come in and said, "Oh, I fell over." And I say, "Oh, did you break anything? Nothing happened?" They said, "No, no, 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 I'm all good." I said, "Well, thanks for taking an unauthorized bone density test, but don't make a habit of that. It's a really bad idea. No unauthorized bone density testing." Okay. So the skipping, though, is just going to put your body into a better space with your vestibular apparatus, your balance. These things are just wonderful. You know, we shouldn't be using handrails to get off toilets. We shouldn't be, we should be playing a little bit. So, I encourage everybody to skip. It's good for your cardiovascular. It's good for your muscles in your body. It's a huge workout, but it's great for your bones because you're just doing a very safe, very small up and down motion, which is compressing the bones. Then you've got to pull them up, pull your feet off the ground so the muscles are pulling on the bones, so they twist a little bit. And plus, it's really good for you in the brain because you've got to do your balance stuff again. Because I'm always concerned about people falling over.
Yeah.
We don't train putting our body in vulnerable positions quite enough. We're not playing like a child anymore, getting our head into different positions. We're now always cautious. We're holding on to things. We're using the couch to surf our way around the room, touching things. So I'm very keen on people to challenge their body and play in a safe way, because if we don't want to have a unauthorized bone density test where you fall over and hope nothing breaks.
Yeah.
That's what we're trying to avoid here. Don't find out your bones are weak because you had a simple trip and now you've got a broken wrist and a broken ankle. That's a disaster. So,
Absolutely, yeah. So I guess you see a lot of people in your consult daily, and are you like, could you just describe some patterns of different things that people, in this case, men and women, do that really put at risk their spinal health and affect their posture, and overall, it will end up affecting their health. So, what are the
sure.
bad habits, the culprits?
So it's pretty clear. The older we get, the less we move, the more we sit. and then we authorize our brain to give us an excuse that we shouldn't do things because of our age.
Uh-huh.
And I think it's nonsense. Uh, there are enough examples of people out there. There's a German woman, I believe her to be German. I've forgotten her name, unfortunately, but she's a 93-year-old gymnast. And you want to see this woman. I watch her videos all the time. She's just as outstanding.
I've seen her.
Where,
It's amazing.
yeah, just amazing. And she's in her 90s. She's not in her 50s or her 40s. She's in her 90s. I know she's a bit of an outlier, but I think the outlier bit is the fact that she never stopped. Whereas most of us stop and we become busy, we defer our attentions from ourselves to other people, and we use these things as a reason why. But meanwhile, our bodies are deteriorating, and then it's very hard to break that as a habit because you've been doing it for some years. So I see people, and what I'm trying to do with people is just encourage them to go back to some simple daily practices. I don't actually care what they do. It's less important what they do. It's just more important that they do it. We can play with the content as time goes on, but if you don't make some commitment to a space where you devote it to yourself, if you can't make that commitment, then you're going to find it a big challenge. And then you're going to down the track be thinking, oh, I don't know if I can do this anymore. And you lose confidence and you don't have the courage anymore to do these things. I find that very, very challenging.
So,
So,
so really, all these back pain, hip pain, all these things that people attribute to basically aging, it's
mm,
of course it's part of aging, but that could be helped and avoided
yeah,
if we
yeah,
stuck
yeah.
to your simple daily, just
Simple
doing a
daily.
little bit every day.
There is no question on that aging is real. There's no question about that. But I say to people, you should tip your cap to it and acknowledge it, but you don't bow down before it. You don't have to just lay prostrate on the ground,
Yeah,
and that's not what's supposed to happen here. We're supposed to try and do enough to remain active without breaking ourselves down. And like I said, if you remember what you did as a 20-year-old and think, oh, that's too hard, you're right. It is too hard. Don't do it. If you are, you're a fool because you will break down. So
yeah.
that's why you need to do things in an age appropriate way. But it's all about the simple daily. It is the consistent daily pattern. It's not how much, it's how often. I have a favored sentence that I use at work all the time is that um, motion is medicine.
Yeah.
It's very clear. And I tell people, then people say to me, oh, so what's the best exercise? My answer is always the same. It is a repeated one. That is the best exercise. I care less about what the exercise is
Just you
in
do it.
the initial phases.
Just to keep.
Just build the habits and then you mold what fits into that habit. That's the key.
Now you got me like right after we finish this podcast, I'm gonna go find my skipping rope and I'm gonna start practicing. So I'm gonna send you a video of day one and then maybe in a month or two, see how good I get.
This is recorded. You've made a promise. I hold you to the
Yes.
promise, which is actually interesting because when we're talking about exercise, it's interesting you say that. One of the there's some very important things around habit, which is important to study. And one of the factors of habit is accountability.
Yes.
So voicing something out loud, like you just did, and then saying you're going to do something, which is send a video, is an awesome way to start developing a new habit. So accountability is an important part of habit creation.
And that's
So
why you said find your team, yeah? If you find someone
find
who's
your
gonna help
team.
you,
Yeah,
is
yeah,
gonna
yeah.
make you accountable for that.
Yeah. I train with one of my friends, and we meet over at the road here very early, and he's just always there. And sometimes he doesn't want to be there, but he knows I'm going to be there. And sometimes I may not want to be there, but I know he's going to be there. So, it's just one of those kind of like, well, okay, this is what we do. And then never forget to reward yourself for your effort either. There's that notion about reward. This is not meant to be self-flagellatory. This is meant to be something which is enjoyable and good. After you go to the gym with your friend, um, for accountability, do your thing and then go for a walk after, or have a coffee, or do something fun, like, and create that little reward that,
I have my own reward, I mountain bike. So the days that we do like most days is there are hard rides. I'm entitled to have a cookie. So it's
sure,
like my
sure,
reward.
exactly,
I
exactly.
earned this so I can have like a
Yeah,
big cookie. Yeah,
yeah.
other days
This
I don't, but because of the sugar,
Yeah.
even though it's a healthy one. But it's that days like if I write, I can have a cookie.
Yeah, sure. That's precisely what I'm talking about. And whether we like it or not, we're just this walking bag of habits. And if the habit is to not exercise, then that's a habit too. Exercise is not just a habit. Not exercising is also a habit.
It is. Yeah,
Yeah.
that's a very good point. Yeah.
Yeah.
So
So,
just one more, it's like, I guess it's all related, of course, to what we've talked up until now. But as we get older, and I don't know if that's more related to menopause from your point of view, from the chiropractor's point of view, but whenever we get injured, and I'm feeling that in my own skin at the moment, we were talking before recording about how I got
mm,
injured, and it's taking me a long time to recover. So joints, and even if there are minor injuries, they take a longer time to heal, or we don't bounce back so quickly. So is there anything we can do about that other than the simple daily from the point
well,
of
well,
view?
firstly, you need to understand, of course, that your blood supply is estrogen dependent too. So, since healing is very much commensurate with blood supply, with estrogen diminishing, your blood supply, bringing all those good elements to the injury site is going to be a little less. The removal of the waste product, the debris of healing is also going to be a little bit less. So you are definitely going to heal slower. The key, I think, is just being aware that an injury that might have taken you 2 weeks is going to take you 4 weeks, or an injury that takes you 3 months is going to take 6 months. It doesn't mean you stop. It just means half of the battle is actually just being aware that this is not going to be a 5-minute cure. This is going to take 5 days, 5 weeks, 5 months, whatever the time frame is. And once you reconcile with that, then you just build into the fact that, well, I can just do a little bit of this, and I can't do those 3 things, but I can do those 6 things. Go do the 6 things. You've got an issue at
Focus
the
on what
moment.
we can do more than.
Yeah.
It's a very
But
good lesson for me. Yeah.
there's no one man or woman who at 50 is not a unique walking sense of injuries to something. You will have your 13-year-old basketball ankle, you'll have your 20-year-old baseball shoulder, you'll have that time you fell off the stairs at university drunk one night and hurt your neck. We've all got these injuries, but they're not meant to make you stop. They just mean that you're unique. You need to build your team of people who can just help you get past these things which exist uniquely in your life, and away you go. I've got a knee that doesn't work properly. It doesn't stop me doing 9 out of 10 things. It does stop me doing, some things. So what? Find something else. Yeah. That's the key for menopause too. You you're just going to be slower, but it doesn't mean you stop. It means you don't do things as long, but doesn't mean you don't do them at all. It means you don't jump off the 2 foot box, but you can jump off the 12-inch box. It's just modifying and being sensible. When I walk into the gym, I don't have menopause issues, obviously, but one of the things I say as a 62-year-old man is don't compete with the 25-year-old guy on the bench press. First of all, he doesn't even know you're there. He doesn't care. He doesn't care
Yeah.
I'm there. But the 17-year-old brain that still operates in here says, I reckon I can do that. I can do that. I can do that. Well, who cares? No one cares. And so you don't want to create any form of injury. So competing with someone half your age is a foolish exercise. You're just going to bust something, and then it's going to take twice as long to heal, if it heals at all. So, yeah, that's why build your team, have your accountability people with you. They will tell you when you're being a fool, hopefully, and you can tell them when they're being a fool, hopefully. And yeah,
That's
that's
excellent.
how I go
That's
about
excellent advice, Greg. So
it.
kind of, focus on what you have, the positive, and understand that aging
Yeah,
is a real process, but there are still many things that we can do. Maybe we
yeah,
have to do it another way, but be consistent on a daily basis with the
yeah.
simple daily, and
Simple as that.
and
Because you
just
don't need to fall off a cliff, right? I view it as you don't need to fall off this cliff. You're going downhill, but just dig your heels in a bit and just slow down that rate of decline. That's what we're after here. Uh, Nothing fancy. You're not going to try and cure anything, but you are going to age with a lot more grace and a lot more confidence, knowing that you can have an input and it's not all bad. It's
and
not great, but it's
that's
not
what
all
we are
bad.
aiming with this platform, right? To just
Hmm.
grace of no age to age
Yeah,
gracefully.
that's
And
exactly right. I really agree with what you guys are doing there. The grace of no age. Yeah,
thank you.
tip your cap to approaching menopause or being in menopause, but don't kneel before it. You know, that's not going to be helpful to you. So,
So let's just wrap up this conversation. And could I
sure.
ask you if you had to give only three advice, two tips to women going through menopause or that just kind of finish
Yeah. Okay.
menopause,
Yeah.
to continue feeling from the point of view of their physical health, which is something that you work with daily,
Yeah.
what would be the three tips you would
Uh,
give?
they're very clear to me. Number one is absolutely non-negotiable. Go lift something heavy. You must do strength training. It is non-negotiable for the muscle loss, for the bone loss, for the joint range. It is just without parallel the single best thing you could do. Don't talk to me about any supplementation or anything. If you're not doing strength training, you're not going to make it. It's just so crucial. Nutrition wise is important. I'm not a dietitian. My wife is, but I'm not. Uh, but the evidence is fairly clear. We don't metabolize properly anymore, or as well, I should say. You've got to up your protein dosage somewhat, and the other thing is with your metabolism. There's the estrogen, it plays with your metabolism badly. So the refined carbs and sugars and things, you know this stuff. It's all very clear.
Mm-hmm.
Minimize it. Don't eliminate it, but minimize it. And the third thing, and this is huge, is sleep.
Mm-hmm.
If you don't get you, I don't care what you do. If your sleep's no good, not that exercise is not going to be as effective. The nutrition's not going to be as effective. So, it's strength, it's nutrition, and it's sleep. You get those things, three things right, you're 80% of the way there. That's for sure. Yeah.
Good. And there are things that are easy to do because really we don't have to go to we don't have to do all these weight lifts like in a crazy way. Like you said,
Yeah.
nutrition is just common sense, or we can find someone like your wife. And now we're gonna have to have your wife on our podcast. I'm sorry, I'm gonna ask that. I didn't know she was a nutritionist, but
Yeah.
let her know
Mm.
she'll be hearing from me.
Okay, I'll let her
And
know.
sleep,
Yeah.
I think we all love sleep. I know during this period, a lot of women have difficulties, and it's hard when I've never had it because of menopause, but I had it because of shoulder pain during months, and really your life is upside down. It's like you can't even think, nothing works, you don't sleep, you are angry, upset. It's
Yeah, yeah, yeah,
nothing
yeah,
works.
yeah.
Yeah, actually.
Nothing works. Nothing works. That's right. Nothing works. So I'm not a sleep expert, but I'm sure people can do their own research about how to try and improve their sleep. I'm not saying fix it, but improve it. Yeah. Yep.
Excellent. Well, I don't know anything else you'd like to add. I think we've covered so many topics, so interesting. And anyone who's listening, hopefully you've learned a lot. I definitely have myself. And I promise, it's like I'm gonna be doing the skipping rope and posting the video. So I'm gonna be, you are gonna be,
Accountability partner.
yeah, you're my accountability partner. I'll try. I have to learn. I'm very clumsy, like I said, but I'll do my best. So
Good.
thank you so much for taking
Pleasure.
the time to be here with us, especially with the time difference. I know it's the end of your day in Melbourne. It's
Mm.
only like 1 p.m. in Europe, Western Europe time, so it's easy for us. A pleasure, and
Thanks, Mon.
hopefully we'll be talking soon. And
Good.
like I said before, I miss you. Just to let you know, Greg is my chiropractor when we're in Melbourne.
Mm.
And since my shoulder injury, I miss him very much, but at least we can talk and do the podcast and everything. Thank you so much.
Thanks, Mon. Thanks for your invitation. I've enjoyed being here, and hopefully some of your listeners can gain a little bit of something out of all of this.
I'm
Thanks very
sure
much.
they will. Thank you. Thank you so much, Greg. Have a nice
Thanks,
day.
Mon.
Yeah, bye.
Thank you. Bye.